And that virus has claimed 353 lives in the province. To discuss this and the sort of discrepancy as far as the lockdown is concerned, we're joined by Gauteng Health MEC, Bandile Masuku. I'm not sure if you heard the words there of the spokesperson for Gauteng government, but he said that there is no level 4, level 5 lockdown imminent in Gauteng. What is the status?
What we said, and good morning to your viewers, what we agreed on as the Executive Council is to see how we can be able to apply and enforce the regulations that will help us to reduce the rate of the transmission. And we know that these actual regulations are the ones that actually are even presently are applying, but are not being actually, respected or being applied by the community. So, as Executive Council, we agreed that we want to see some of those regulations coming back, and also making sure that those who give us maximum impact in terms of reducing the rate, they should be enforced, and they should be applied in that way.
Okay, remind us of the regulations and how does that differ from returning to a hard lockdown?
The one regulation that is obvious that we are actually dealing with, which is a big problem, is the one of people gathering in groups. People have defied that. People are gathering. People are organizing intentionally and deliberately organizing social events where they are organizing parties, organizing weddings. And those are regulations that prohibit that type of action. And those are things that we want to see being enforced, where people shouldn't gather being mutually more than 50, and they shouldn't gather if it's not actually necessary. We're looking at funerals which are necessary, but others, they shouldn't gather at all. So that's one of them that we need to actually definitely strictly enforce.
And yet you suggest that alcohol sale is restricted to one day. I mean, that will force people to gather.
That the issue of alcohol restriction is one that is also within the provincial purview in terms of our own constitutional powers, and which we can be able to regulate. We have seen the impact of reintroducing the sale of alcohol, what it has done to our casualties, to our trauma units, and it's something that as a provincial government also took as an EXCO. We took a very strong decision, around it, and we just feel that it should be, properly regulated.
Let me ask you this: the fact that you're even having this discussion. I mean, we were told that lockdown and all of that prior to where we are today was to get the country hospital medically ready. Does it suggest that we have failed in that, or did we get the numbers wrong?
No, we didn't get the numbers wrong. I think our modeling was quite accurate in a bigger way, in a big sense, because it did predict that we are going to go through June without much of a problem, without a bed capacity. But it also predicted that in July we are going to have a gap in terms of shortages of bed, and that's why we have an intervention plan that will cover that. But overall is that the modeling was done with the understanding or with the context in which regulations are fully applied and they are actually being respected. And at the current moment, the way the situation is, the regulations are not applied, the regulations are not fully implemented, and there's blatant disregard of the regulations, and some of the other regulations that have been made have actually reduced the impact of it.
Okay, what sort of timeline are we, excuse me, jumping in, what sort of timeline are we looking at now before these new regulations are imposed? And I'm wondering how you are going to oversee them, considering that taxis, for example, are operating at 100% capacity.
It is a discussion that we are having with the National Command Council, and it's something that must be actually able to. But one thing for certain, they won't be able that as a country we are able to hospitalize 52 million people. So in terms of planning and everything, we should be planning for those numbers that will require actual hospitalization. And at the moment that our modeling has given us, we will be able to fulfill and be able to close the gap with field hospitals and be able to do that. So their regulations are existing. So we are just calling for stricter observation of these regulations and the application of these actually regulations, and that will see us through. And there would be other proposals that we had made in terms of how we can timeously, predictably close down some of the aspects of the sectors in terms of business, which have actually indicated to us that they are one of the cause for concern.
All right, let's leave it there. Bandile Masuku, thank you.